Hello everyone, welcome to our video. We are third year students of CVSc&AH Silisi Aizol. I am Rakuya Cecilia.
And I am Lunkim Janet Kim Hongsai. Today we will be talking about a very important disease called rabies. We will be learning about its prevention, outcome and control. Let's get into it.
One bite, one virus, one life. Let's break down rabies. Rabies is a fatal viral disease. It affects the central nervous system, brain and spinal cord. Caused by rabies virus, Lissa virus, transmitted mainly through bites, scratches or saliva of infected animals.
The incubation period is usually 1 to 3 months, can be weeks to years. Here is a table showing how the distance of the bite influences the incubation period. The clinical signs in animals include behavioral changes, like aggression or furious rabies and excessive salivation. As the disease progresses, the animal may develop paralysis, sometimes called dumb rabies, difficulty swallowing and leading invariably to death.
Humans, there is fever, headache, anxiety, confusion, hydrophobia, paralysis, coma, and death. Now let's move on to prevention of rabies. How do we prevent this disease?
A strategic plan was launched in 2018 called 0 by 30 by the United Against Rabies Collaboration, aiming at zero human rabies death by 2030.
This is a One Health approach focusing on vaccinating dogs, improving awareness, and providing human vaccines or treatment, which are the main features of this video. Let's dig further into it. For animal vaccinations, regular vaccination of dogs, cats, livestock. First dose at 3 months and booster every year is recommended.
Some commercial brands are Nobivac, Rabies, Gandigen, and Roxarab. Human vaccination, pre-exposure prophylaxis for veterinarians, animal handlers, laboratory workers, and wildlife workers.
First dose on day 0, second dose on day 7, and third dose on day 21 or 28. And for post-exposure prophylaxis, after bite or scratch, immediate wound washing with soap and running water for at least 15 minutes. Apply antiseptic like iodine or alcohol. Use of anti-vaccine like Rabipur, Lorab, Rabivax-S, and Indirab. The schedule for the vaccine is day 0, first dose, day 3, second dose, day 7, third dose, and day 14, fourth dose.
For severe bites, rabies immunoglobulin on day 0 along with vaccine. When dogs fight and rabies exposure is suspected, they should be taken to the vet immediately. The vet will examine the wound, check vaccination status, and decide if a booster rabies vaccine is needed.
After this, the most important precaution is isolation of the exposed dog to prevent further spread and observe for clinical signs.
Now let's move on to control of the disease, breaking the chain. The first step is mass vaccination of dogs, cats, and livestock. At least 70% of the population must be vaccinated.
Surveillance and reporting suspected rabies cases, laboratory diagnosis, monitoring outbreaks. And fourth is quarantine measures. For suspected animals, isolated for observation, avoid contact, restrict movement of infected animals.
Conclusion: rabies is a deadly disease with no cure after symptoms appear, but it is 100% preventable with timely treatment and vaccination. By washing wounds, taking vaccines, and vaccinating animals, we can save lives. Remember, act fast after a bite, vaccinate to prevent rabies. Together, we can work towards a rabies-free future.